Hello everyone. Today's session is about the basic of respiration and spontaneous breathing. We will be going to learn what are the basic phases, process involved, and the basic difference between the respiration and breathing. What is respiration? So, when we take a breath, there is a gas exchange happen between the human body and the environment. And this particular event, it happened in two different phases. That is called as external respiration and internal respiration. So here is the proper definition of the respiration. Respiration is the gas exchange between the human organism and the environment. So when a human body take any breath, it goes pass to your mouth, to your trachea, to your lungs, and then bronchus, and then it pass to the blood, and then to the body tissues. But in this whole process, what is the external respiration, what is the internal respiration? So the external respiration, in which usually if you take any breath, the gases or the air, it pass through the lungs and to the blood, that is called as external respiration. Now that gases which has been mixed with the blood, it has been passed to the body tissues, so that is called as a internal respiration. So the exchange of the gases between the blood and the tissues is called as a internal respiration. So what is spontaneous breathing and what are the process involved in that? The responsible process for a breathing is the inspiration and expiration. When you take something, some air inside your body, that is called as the inspiration. And when you throw it out, it's called as the expiration. So what is happening in that event? What is happening? What are the gas exchange happening in that event? Is that diffusion of the O2 from the alveoli to the blood and the CO2 from the blood to the alveoli, and the transport of the oxygen to and the CO2 from the body cells. So what is happening in the inspiration is that O2 which you have taken from your mouth, that you have from the normal air, or the O2 from the alveoli to the blood, it got mixed with the blood, and the transport of oxygen to the body cells. So and what is happening in the expiration, that the CO2 from the blood to the alveoli, that CO2 which exhaust by your body cells, that goes back to your bloods, and then it transferred to the alveoli, and then it came back to your trachea, and then to your mouth, and then you exhale something. So this process is known as the breathing. So in the next slides we will discuss in detail about the expiration and the inspiration process. Inspiration. So guys, as I told you, inspiration is the process when you take some air or O2 inside your body, and then your lungs area become larger. So that process is called as a inspiration. So what all the events happen in that phase? So as you take some air inside, so what is the first thing happen? Contraction of the diaphragm. The diaphragm which we are talking about is this. So the diaphragm goes to the and contraction of the diaphragm and the intercostal muscle on the downward of your body. So that diaphragm is go a little to some inches down to your body, so that you can suck some air inside to your lungs, and then negative pressure is generated due to the lungs to the atmospheric pressure. There is some negative pressure generated inside the lungs. Expansion of the chest, that your chest become more larger, your body circumference of the chest become larger, and your lungs will swell. An increase in the lung volume. Air comes passive from the environment to your upper airways. Here the upper airways is this area. So air comes inside your body through this area. There's some negative pressure generated. Diaphragm will go down and your chest area will expand. What is expiration? So expiration is a little opposite from the inspiration, you can say. So in that inspiration, your diaphragm has gone downward to the direction, so that you can suck some air inside your lungs, or the O2 or the normal air you can suck inside your lungs, and that pass to your blood, to the alveoli, and to your body cells. So now in this case, in the expiration, you have to throw that waste gases like the CO2 and the other gases to out of your body. So now, so what is happening in the expiration? So your diaphragm will move in the negative direction, you can say in the upward direction again. So what will be happen? Relaxation of the diaphragm and the intercostal muscle. Then inspiration, it was stretched to the downward so that it can suck some air. Now it's going to relax in your normal position. So it's a relaxation of the diaphragm and the intercostal muscle. So it go upward so that it's push some that waste gases out from your body. Okay, positive pressure is generated inside your lungs. In that inspiration it was a negative pressure, and now in the expiration it is a positive pressure inside your lungs, so that you can throw some air, that extra air out from your body. And reduction of the chest area, that is normal, that in the inspiration it was expanded, and the expiration, when you're throwing out that waste gases, it will go back to your normal position. And decrease in the lung volume, and now air comes back to the environment through the upper ways. So now the air or the CO2 or the waste gases, when this diaphragm go upward, the lungs area will be decreased. Now it go back to to from your upper airways, from your mouth, and then it will be exhaled to the environment. So this is called as the expiration. Guys, how's now the respiration and the spontaneous breathing idea has been cleared. So here is a small pictures of the respiratory system and the inspired and expired gases, how they travel to the body cells. So here is you can say is a nostril, and now this is trachea, bronchus, and this is the trachea, this is the upper airways, the trachea, bronchus, alveolus, lungs, and this is the diaphragm, this small dotted line, and this is the abdominal cavity. So now when you inhale some air inside your body, so it is will be having the high oxygen level and the low CO2 levels. So it goes to the blood vessel through the alveolus. So human body having more than millions of alveolus. Whenever this you inhale something, alveoli area become larger, and then it transport the O2 to the blood vessels. Now blood vessels travel to the heart, and heart will pump it throughout your body. Now the waste gases which has been generated by the body tissues, it goes back to the heart, and then again these vessels which are going surrounding them during the expiration process, these waste gases goes to the alveoli and back to the trachea, and then it came out from your mouth. So this is the normal process happened in each and every breath you take in and throw out from your body. So this is all about the respiratory system and the spontaneous breathing. Stay tuned for our coming up session. It will be on the mechanical ventilation and modes of ventilation, where we will discuss some more basics about the ventilation and its modes.